The integration of robotics in orthopedic surgery represents a significant advance in medical technology, promising improved patient outcomes through enhanced precision and customization. Robotic systems in joint replacement and other orthopedic procedures have gained traction due to their ability to aid surgeons in performing complex and delicate tasks with heightened accuracy and consistency. This narrative explores the multifaceted roles and benefits of robotics in this crucial medical field. Robotic systems in orthopedic surgery, particularly in joint replacement, are designed to optimize surgical planning and execution. Preoperative planning is augmented by 3D imaging and mapping technologies that allow surgeons to develop a detailed surgical plan tailored to the patient's anatomy. The robotic systems utilize this data to assist in precisely positioning implants, ensuring alignment and balance in ways that are difficult to achieve with traditional methods. This precision is crucial, as improperly aligned implants can lead to complications such as increased wear, implant failure, and the need for revision surgery. For instance, robotic-assisted knee replacement procedures employ systems like the Makiplasty, which uses a robotic arm to help surgeons in achieving optimal joint alignment and ligament balance. Through preoperative imaging, surgeons can visualize a 3D model of the patient's knee, planning the procedure with exact specifications. During the surgery, the robotic arm guides the surgeon, ensuring that bone cuts are made with millimeter precision, reducing the margin of error. This results in a more natural-feeling joint post-surgery and accelerates patient recovery. Moreover, robotic systems enhance the reproducibility of surgical outcomes. Traditional methods can have variability based on the surgeon's experience and technique. In contrast, robotic systems provide standardized procedures that minimize these variables, contributing to more predictable and successful results. Robots also offer the advantage of minimally invasive surgery, which reduces tissue damage, blood loss, and recovery time. Beyond joint replacement, robotics is making strides in other orthopedic areas such as spinal surgery and fracture management.